Hello, my name's Tim Roark. I'm here to do some education on the Hamilton T1 ventilator and its use with the neonatal circuit. This is the packaging that the neonatal circuit will come in. Then here's the contents of that package. You have your circuit with your exhalation valve, your flow sensor tester, and your pressure line for when you're using non-invasive ventilation. So now let's look at how we connect the circuit to the ventilator. First, we'll connect the exhalation valve. And as you see, the exhalation valve has a spout down here. There's only one way that it can connect. And you want this knob turned all the way to the left so that when you go to connect it to your exhalation valve, it just slides in like this, all the way down, and then you turn this clockwise to lock it in place. Okay? So that's your exhalation side of the circuit and the exhalation valve. Then your inspiratory line connects right here. And now for our flow sensor, this is our flow sensor. Your blue line right here connects to the blue port. Just slide it on there. And your clear line attaches to the white port. Just as such, okay? So now we have the circuit attached. So now we will turn the unit on and put it through its pre-use test. So to turn it on, you press the power button. And then it will run a self-test, a pretty quick self-test. Self-test is done. Now, if you notice at the top, it says wrong expiratory valve. Because this is a neonatal circuit with a neonatal valve, we have to be in the neonatal mode. So when we switch over to neonatal, and now we will do the pre-op test, which is this button right here. Select it. And first we'll do a leak test. Tells you what to do right here. Disconnect the patient. So I'm going to take the red stopper out of the end. Now it says to block the breathing tube, so I'm going to connect this back. Reconnect the circuit, so I'm going to take this off, and the leak test is done. So now we will do the flow sensor test. The flow sensor will attach right there at the end. And then we have an adapter that we have to use to test out the flow sensor. So we put it in place because in just a little bit I'll have to flip the flow sensor. So I'm going to hit flow sensor test. Disconnect patient. It says to flip the flow sensor. So I flipped it. Calibration in progress. That tells me to flip it back. Calibration in progress. All right, so that one's done. We got the check mark. So then the next thing that we would normally do is the O2 sensor test. That doesn't have to be done every day, but that's something you will want to have done at least once a week. And because that takes a little time to do it, I'm not going to do that, but all you have to do is press flow sensor test, and there's no flipping of anything. It automatically does the O2 sensor test. okay? And that is how you set up the circuit and do the pre-use check on the T1 ventilator using the neonatal circuit.